So did you know that 1 out of 3 individuals in the US is behind on their colon cancer screening? Well, in this video today, in celebration of Colon Cancer Awareness Month, we will discuss why that is such a big deal, what exactly is colon cancer, what are the signs for colon cancer, how do you get colon cancer, can it kill you, and I'll give you my tips on what you can do to prevent colon cancer today. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, likey, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks like you're learning in this video. So it really is a shame that so many individuals are not getting their colon cancer screening. Colon cancer is the second leading cause of cancer death in the United States, but is the #1 most preventable cancer that's out there. And the best way to prevent cancer in the colon is to get screened for it. It is literally the worst news I can ever give somebody, is to tell someone they have a cancer that could have been prevented if they got their screening done earlier and sooner, and we found those precancerous lesions. So what exactly is colon cancer? Colon cancer usually comes from a growth in the colon. These growths are called polyps. Now, a lot of people have polyps, and for a lot of people, these polyps don't cause any symptoms. This is why it's so important to get screened when you're feeling well, because these polyps over time will grow and get bigger and bigger and bigger and bigger, and eventually at some point in time these polyps will become cancer. Now, once again, the difficult thing about colon polyps is that in the vast majority of people, especially if they're small, they don't cause symptoms. So you right now could be having polyps grow inside your colon and not even realize it. Now, there are some symptoms to be aware of that may make it more likely for you to have a large polyp or even to have cancer. #1 is rectal bleeding. Bleeding is never a normal thing. Let me repeat this one more time. Bleeding is never normal. Don't just assume it's a hemorrhoid. Don't just assume it's nothing to worry about. Rectal bleeding is a cardinal symptom of colon cancer or a large colon polyp. This needs to be investigated to find out exactly what's going on. #2 is a change in your bowel habits, especially if you're over the age of 45. So for example, let's say you used to be constipated all the time and all of a sudden, hey, I can go great. In fact, I'm having diarrhea. No, that's not a good thing. A new change in bowel habits over the age of 45, it could be a sign of something growing inside the colon. And vice versa as well. Let's say you've been having diarrhea your whole life and all of a sudden you're now constipated. That change is a cardinal symptom that something else could be going on. #3 is anemia. So even though you may not notice any loss of blood, your blood count may be low. We can check this with a simple blood test, but you may have signs of anemia. You're tired, fatigued, you don't feel very good, maybe you have a weird taste in your mouth. These are all signs of anemia or a low blood count. Next is really bad abdominal pain. Now, pain can be a normal thing for a lot of different people, and pain can be a very difficult symptom for us to know exactly what's going on. For some people, pain can be a sign of irritable bowel syndrome, colitis, maybe gallbladder issues, or pancreas issues. But pain can also be a sign of colon cancer, especially if it's coupled with some of the other warning signs like bleeding or even weight loss. Now, unfortunately, once you've been diagnosed with colon cancer, we need to determine the stage of that cancer, because that will determine what the next steps are going to be. Now, if the cancer is just confined in the colon, it's only in the colon and hasn't spread anywhere else, there's a chance for not only treating that cancer, but possibly curing that cancer by removing that part of the colon. But if it's spread elsewhere outside the colon, mainly to the liver, which is the most common area for spread of colon cancer, that means you most likely have stage 4 cancer that may need further chemotherapy, radiation, and surgery as well. And the test that we do to help determine the stage It involves a colonoscopy to see what's going on, but also a CAT scan or a CT scan to see if there's any spread of that cancer. Sometimes we have to do other testing, including further imaging testing, to really help us to know what's going on. And sometimes we have to test your lymph nodes to see if there's been any microscopic spread of that cancer. But even though colon cancer is the second leading cause of cancer death in the United States, you do not have to get this cancer. Let's go over 5 ways you can prevent colon cancer today. Number 1 is diet. We're seeing so much evidence how diet plays a role in gut health, and diet does play a role in your risk for developing colon cancer. A diet that's high in inflammatory foods like meat, charred foods, will increase your risk for developing colon cancer. We're seeing more and more studies with that. Number 2 is alcohol. Now, alcohol can be such a significant toxin to your whole entire body. It can increase your risk for esophageal cancer, throat cancer, pancreas cancer, liver cancer, and colon cancer. In fact, your colon cancer risk will increase by 60% with more than 2 drinks per day. That's crazy. That's more than double the risk. There's such a significant risk factor with that. Number 3 is fiber intake. A diet that has low fiber is going to increase your risk for developing colon cancer. You need to aim for 25 to 30 grams of fiber per day, or maybe 6 to 8 cups of vegetables per day. There is so much evidence that fiber plays such a significant role for your gut health. It decreases inflammation, it decreases leaky gut, and for this video and for this topic, it does decrease your risk for developing colon cancer. Number 4, yogurt. Yes, yogurt. Daily yogurt has been shown in combination with fiber to decrease your risk for developing colon cancer by 20%. We think it may be some of the probiotics that are in there or some of the prebiotics that are in there as well. We don't quite know exactly what role that plays. And lastly, the most important thing that you can do today to prevent colon cancer is to get screened. As simple as that. Now, you can do all the dietary things in the world. You can do everything to eliminate alcohol. You can eat all the yogurt that you want. But if you don't get screened, you still have a good chance of developing colon cancer. That screening starts at the age of 45 unless you have a first-degree relative who's had colon cancer. That may change when you need to do your screening test. Now, keep in mind, I'm stressing screening. I'm not saying colonoscopy for everybody. Now, if it was my choice, the colonoscopy would be the test I would recommend for everyone, because not only can that find precancerous polyps, but it can remove them as well. But not everyone wants a colonoscopy. I completely understand. It is not, a day in the park when you have to drink that prep, clean yourself out, and come get that scope done. I completely understand. But at least if you are not going to go for the gold standard, which is the colonoscopy, do some other screening tests, whether it's pooping in a box, maybe checking your stool for blood, or any other test that your doctor is going to order for you. But just get screened. So these are my tips on what I recommend to help prevent colon cancer. My question of the day for you guys: what questions do you have to prevent colon cancer? What has been your experience with getting a colonoscopy? What other recommendations do you have? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. You know you want to. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks like you're learning in today's video. Guys, I want to thank you for watching, and don't forget, get screened! Please, please, please. Guys, let's talk about poop. Bye, everybody.